My name is Dimitra Nikolopoulou and I am a regulatory toxicologist at the Laboratory of Pesticides Toxicology at Benaki Phytopathological Institute, BPI. BPI, just as an introduction, is, sorry, I have the background noise. Okay. BPI is the Greek competent authority for the risk assessment of pesticides, including biocides. So today I will be giving you a presentation on the safe use of biocides for human health in the context of Biocidal Products Regulation and discuss approaches and challenges. So within the EU, biocidal products are regulated under Regulation 528 of 2012, that is well known as the Biocidal Products Regulation, or briefly BPR. BPR has been in force since September of 2013, and it has a dual purpose. On one hand, is to ensure that the use, the making of the market, the making in the market and use of biocidal products is harmonized within EU, but at the same time ensure that there is high level of protection for human health, animal health, and the environment. In this context, and to ensure protection of human health and sustainability in the use of biocidal products, it is important to define risks that are posed by the use of biocidal products for different population groups in different areas such as school, workplaces, kindergartens, public places, geriatric centers, and so on, in the form of performing risk assessment. A second step would be to identify measures to minimize risks. With regard to risk assessment, the risk assessment process for biocidal products involves an evaluation process which is described in BPR, and specifically under, sorry, can you see me? Okay. It is specifically described under BPR, and reference is made to under Annex 6 to the BPR, where the common principles for the evaluation of biocidal products, including representative products in the context of active substance approval, are included. Technical advice on how to perform risk assessment is included in specific ECHA guidance, which is the guidance on the Biocidal Products Regulation. Currently, version 4 from December 2017 is available, and it is publicly available in the web link indicated for your reference. Just a couple of definitions that are included in the guidance and in the regulation, just to ensure that we have a common understanding of the risk assessment process. Briefly, the risk assessment process involves the assessment of human health effects, the hazard part. It involves the exposure assessment, and it involves the risk characterization. So what are these components? With regard to the hazard component, this hazard is the toxicity of a compound, and that is the toxicity of the biocidal product or the toxicity of its individual components. What does it mean? It means the inherent capacity of that component to cause harm. So it is a property of the compound or of the product. As part of hazard characterization, we have to estimate and define the relationship between the dose, the concentration, and the response, the effect, and therefore define specific health-based guidance values. Health-based guidance values are regulatory values, but in practice, they are values indicating the levels or the doses where you do not expect to see any adverse effects on human health. The second part is the exposure assessment. With regard to exposure assessment, what we are required to do is estimate the concentration or the dose to which human populations will or may be exposed as part of a specific use pattern. And the population groups we are concerned can be those involved in as part of their work, consumers, and humans which are exposed indirectly via the environment. And this can include the general public. In the third part, risk characterization, what is actually done is a comparison is performed of the effect of the dose that is actually safe for humans. In other words, that you do not expect to see any adverse effects, to the exposure level. That would mean that you estimate the likelihood of this toxicity to actually take place, provided you are considering a specific use pattern. How do we assess toxicity? That is specifically described in the Biocides Product Regulation, in the BPR, that different endpoints should be addressed. And these toxicity endpoints include acute toxicity, irritation, corrosivity, sensitization, repeated dose toxicity, mutagenicity, carcinogenicity, reproductive toxicity, neurotoxicity, immunotoxicity, endocrine disruption, other properties on the active substance that could include, for instance, mechanistic activities or other activities on mode of action, human relevance, and so forth, as well as effects due to physicochemical properties. And what are the source documents for assessing all these toxicity endpoints? All relevant sources for scientific data are considered. This can include data which are provided from the industry and maybe in vitro or in vivo experimental data, as well as additional information which can come from predictive toxicology, that is in silico tools, scientific literature, or epidemiology and medical data. With regard to exposure assessment, we, according to regulation, according to the BPR, different population groups have to be considered. So exposure of professional users, non-professional users, and humans exposed directly or indirectly via the environment, and also are considered. And also particular attention is paid on specific population groups which are considered vulnerable. These include, for instance, the elderly, pregnant women, women at breastfeeding conditions, immunosuppressed individuals, infants, babies, toddlers, and so on. How is exposure assessment performed? There is specific guidance, which is the Biocides Human Health Exposure Methodology, and the link is provided on the screen, where you can use to actually, and you can follow to actually predict what exposure would be, and provided a specific use pattern. The Biocides Human Health Exposure Methodology described is supplemented by opinions of the Human Exposure Expert Group and recommendations of the Ad Hoc Working Group on Human Exposure. These expert groups deal with very specific issues as they come up during evaluation processes and provide more specific advice than what is included in the exposure methodology. In the following step, we need to consider exposure and toxicity parameters in order to conclude on risk characterization. Briefly, this is an outline of what we have to consider. E stands for exposure, and this is the health-based guidance value, which is, as said previously, the dose where you do not expect to see any undesirable effect on human health. So in order to have an acceptable risk to human health, it is necessary that the exposure levels from a specific use pattern are always below the health-based guidance value, even if this is without any risk mitigation measures or with the use of specific risk mitigation measures. When we consider risk mitigation measures, these include either the use of personal protective equipment, such as gloves, coveralls, masks, filter masks, and so on, as well as restrictions in use. In cases where exposure exceeds the health-based guidance value, even with or without the use of any risk mitigation measures, then a safe use is not identified. Now, in this process of risk assessment of biocides, there are several challenges that we encounter. Here, reference is made to product type 18. Biocidal product type 18 includes insecticides, acaricides, and products to control other arthropods. I have included in this presentation several examples of such challenges. For example, with regard to non-professional users, including the general public, it is stated in Annex 6 to the regulation that it is only possible to authorize a biocidal product when a safe use is identified performing risk assessment, when no risk mitigation measures were considered necessary. So this means in practice that in case risk mitigation measures were necessary to identify a safe use, performing risk assessment, then this product cannot be authorized for use by non-professional users and for secondary exposure of the general public. Another example of a challenge encountered during risk assessment and decision making is the evaluation of identified substances of concern. Substances of concern are chemicals that are included in a biocidal product other than the active substance. And these chemicals meet the criteria for classification as hazardous according to the respective regulation, the CLP regulation, and they are present in the product at such levels that the product is considered hazardous. That is one parameter, and another parameter is that a substance of concern is a substance, again, other than the active substance, where the community has set a workplace exposure limit. So for these two cases, Annex 6 to BPR states that you should perform a risk assessment as you would for the active substance. Now, what is the challenge? Is the availability and reliability of hazard data, of toxicity data for evaluation, which is often not sufficient and not in the quality or amount as you would find for the active substance. These substances, which are included in the product other than the active substance, are usually chemicals that are regulated under the REACH regulation and do not have biocidal action. So the challenge would be that the information available is not sufficient to identify toxicity or to set a health-based guidance value in order to conclude on risk assessment. Another challenge in human health risk assessment is the identification of compounds within a biocidal product and concluding on the product with regard to the endocrine disrupting properties. There is a practical approach that has been accepted with regard to the assessment of endocrine disrupting properties. And there are three options according to this guidance, to this approach. According to the first option, if none of the product components have endocrine disrupting properties, then substances that are apart from the active substance called formulants would not be considered substances of concern, and the product would not be considered an ED, an endocrine disruptor. Now, if the coformulant was identified as an ED, then that would automatically mean that the substance is a substance of concern, and the product would be an ED. Now, for decision making, this means that the product would not be approved. And there are substances for which there are indications that may have endocrine disrupting properties, but data are not sufficient. So in this case, further assessment in the frames of REACH, the REACH regulation, would be needed. The substance is provisionally not considered a substance of concern, and a conclusion is not possible on whether the product is an ED. In this case, it is a risk management decision on whether the product will be authorized in a member state or not. Another challenge is aerial applications. Aerial applications are prohibited in the EU unless there is a need to protect human health. And in these cases, emergency measures are taken. Nevertheless, there is currently no suitable exposure model, and it is not possible to perform risk assessment, and risk characterization cannot be completed. So that was my presentation, and I hope it was clear. And I will.
Thank you very much, Dimitra, for the nice presentation.